right. Hi, everyone. Happy Empower Hour. Welcome back. So today we have our first doctor on the podcast, which makes this so official. And apparently, I feel like I almost went to medical school, which I did not at all. Dr. Rena Malik, a urologist and pelvic surgeon.
Yep.
Surgeon, which means she does surgery on the human body. And she looks like this, a model, gorgeous, fabulous, beautiful. We've just become recent friends. And we're going to learn all about her and have these conversations about health and wellness that people don't want to have.
Oh, yeah.
And you're changing the game. And she's also an influencer. You're going to follow her. I'm going to put her information here. She's a legit influencer and educating people about our bodies, which I think we all need to talk about more often. Okay, Doc, talk to me. Welcome.
Well, Gina, thanks so much for having me. It has been so lovely to get to know you. And for those of you who want a little inside scoop, we know each other from a mutual friend who grew up with Gina, who is also an amazing human being.
Sabrina.
Shout out to Sabrina.
We love you.
We do love you. And thank you for bringing us together.
Yeah. So, okay, I always start asking my guests 3 adjectives to describe yourself, please.
Determined, powerful, and loving.
Oh, okay. So you are a surgeon. You're a doctor. Always let's start at the beginning. Who were you, the little girl? What were your dreams? Where did you start?
Yes, very different from what I am now. So I grew up in a very South Asian household. We were told become an engineer, a doctor, or a lawyer, right? 3 options, that's what you get. And I was a very good little Indian girl. I did what I was told. I went to Gurdwara, which is our church, every weekend. I learned all the prayers. I did all the things. I learned how to dance. I did all the dances. And so we did all these things when we were growing up to make our parents happy, right?
Nice.
And I'm very happy I did. I have no regrets. I feel like it made me who I am today. But part of what we were told as a cultural thing was like, as a woman, you're there to look pretty, you're there to be quiet and, speak when spoken to sort of thing. These are not things that are told to you directly, but they are sort of implied.
Modeled.
Right. But I was fortunate that as an only child, my parents sort of saw me as their son and their daughter. And so they were like, you can do anything you want. But of course, they wanted me to be a doctor. I decided to be a doctor, though, after doing some research. Like I sort of tried some different jobs when I was in college, tried some different things, and realized that I still really enjoyed the idea of taking care of patients and helping people heal. And I loved the fact that I could be a part of that.
Yeah.
So that's why I decided to go to medical school. And I went to medical school, went to NYU School of Medicine, which was an amazing medical school. Just had a wonderful time, met my husband there. He was a resident at Mount Sinai. But then is when I realized that I could be more than I thought I could. So when I went into medical school, I thought, okay, I'm going to be a medical doctor, maybe a cardiologist. And then I did my surgery rotation and was like, oh my God, I love this. This is exactly what I want to do. I want to be able to fix people. Whereas in traditional medicine, what you think of medicine as a regular doctor who's not a surgeon, it takes time. You got to have patients who will take their medications or listen to you. And I found that a little bit frustrating because a lot of times you're trying to tell people to take their meds or explaining it and they don't understand. And we're all limited by time, which I'll get to a little bit later. But ultimately, I loved being in the operating room. So that's what kind of made me explore operating and surgery and look at the subspecialties of surgery. And when I did urology, a field that I knew nothing about until I walked into the operating room of a urologist, I was like, wow, these are my people. One, we do such cool kinds of surgery. We do robotic surgery. We do endoscopic, meaning we use cameras and go through where your urethra, where you urinate from. And we can do so many things with very little incisions, robotic surgery. And you can do big open surgery. So I was like, this is amazing, right? And the most important thing, which I will tell anyone who's deciding any sort of field to go into, is find your tribe. Urologists, I immediately noticed, were my tribe. They're really happy. I always joke
they are happy people.
Yeah. And how serious can you take yourself when you're dealing with genitalia all day? So I found that it was just a group of people who were happy, who, brought you in, made you feel warm and invited. And so I went for it. And I remember being like, I can't be a surgeon. How can I be a surgeon? And my husband looked at me, who was my boyfriend at the time, was like, it's training for a reason. You get trained to be a surgeon. You're not going to go in knowing how to be a surgeon. And that's when I realized like I can do anything I want to be. And so went through residency, came out, and I think I know I was underestimated. So my chairman at one point said to me, I'm really surprised. We really didn't think you were going to be that good.
Stop.
Yes.
You're
And he really didn't mean it in a bad,
thanks?
I don't think he meant it in a bad way. I think he meant it as a compliment. But ultimately, as a woman and as a, South Asian quiet woman, like you are underestimated. And so I came out, very well trained, went to a wonderful fellowship where my mentors are still my great friends and people I lean on regularly, and then went into practice. And then my journey from there is sort of interesting because while I was in practice, in academic practice, meaning we do research, we teach residents, and we practice medicine. During that time, I realized I wanted to do research that was improving people's literacy. Like we do so much to teach people things about their health, but we have 30 minutes, 15 minutes to talk to you, and you're stressed as it is coming to the office, seeing a doctor about something that's really intimate, usually as a urologist, really intimate or really scary if it's cancer or something like that, and you're supposed to remember all that. So, my interest in research was on health literacy, but I realized that the process of doing research to develop something that improves health literacy and then disseminate it would take years. And so I then decided to try doing education on my own. And that was what led me to social media and eventually to YouTube. And so it comes from a place of all I want is to empower people with their health and their knowledge and educate them on their bodies. Like I would feel so bad that somebody would spend all this money to find parking, to wait for me to see them, for me to just tell them you're drinking too much coffee or you're drinking, like simple things that if they just knew that coffee irritates your bladder and maybe I should cut back and see if it makes a difference, they would have saved that visit, right?
Now you know.
So, and not everybody, so like don't give up your coffee, but you can try without it for a couple days and see how it goes. But ultimately, these were sorts of things that I wanted people to know. And as the channel grew, it became more of like, let me answer those questions that no one's answering for you, right? Like you want to know, like, why does my discharge look a certain way? Or why does my Siemens taste a certain way, whatever, right? Those sorts of questions. But realistically, people want to know. And people want to know, like, can I change this? How can I optimize myself? What can I do at home, right, to make myself better? So.
Well, that's our podcast for today. Okay, so see what we're working with. Okay, so let's take it a step back for people listening who maybe don't really know what a urologist is. And I grew up, my dad was a surgeon. I grew up around medicine, but you educated me during our lunch recently that a urologist is not just for a man. I mean, I didn't know that. So what is a urologist?
So
who needs to see one?
Absolutely. So by definition, a urologist is a doctor and surgeon of the genitourinary tract. So that includes the kidneys, the ureters, the bladder, and the genitals. Okay. And so we see people for all sorts of different things, and there's different subspecialties. So we can see people for, commonly you'll hear about kidney stones, prostate enlargement, but we also see people for overactive bladder, urinary incontinence, prolapse, male infertility. So there's so many different things, and I specialize in sexual medicine for both men and women, as well as pelvic pain, bladder issues, which is like leakage, overactive bladder, prolapse, and then hormone management. So people who have low testosterone or are concerned about low testosterone. And I've recently become menopause certified, or just took the test for menopause certification so that I can take care of women who are going through menopause.
Such a big conversation.
So much. But ultimately, we do a lot. And so for men, I mean, people think it's very easy, like, oh, you know why you need to see a urologist because you have urinary problems. But women can also see a urologist for their urinary problems, for that bulge they feel down below, or for that pain they're having with sex. All that stuff can be managed by a urologist. Okay.
So then people go to their doctor, primary care usually, and don't realize that a subspecialty that they could be referred to is a urologist who can help. So I want to pivot to talk about your social media and your education and the reason why you luckily are an influencer, because I've seen your videos and you go in on these topics that people don't want to talk about. Everyone knows about them. It's on everyone's life.
Yep.
And you just pull back that curtain, address that elephant in the room. And it's so matter of fact. And you do break it down to a very fundamentally easy thing to understand. Like, oh, I never thought about that. Instead of like your Google medical degree that people, don't confuse your medical degree with my Google search or something like that. But what would you say, based off what you've seen, what are your top 3 common questions or popular videos that people are just, it's taboo or we're embarrassed to talk about?
Yes.
What are those?
So at least my audience is highly male. So a lot of the popular videos about genitalia and how to increase length or increase girth of the genitalia, how to deal with...
Is that possible?
So there are several studies, there are several techniques that have been reported on, but as of yet, there is nothing that is sort of gone through rigorous investigation that is excellent in terms of safety and improvement. So like women have breast augmentations. There's not some corollary in men. There are some options. So the safest that I've, through all my research at this time is traction therapy. So you can buy these traction devices and you can use them for prolonged periods of time, and they can lead to an increase in length. Whoa. That usually takes about 2 centimeters. So it's not going to be like huge, but it's something.
Sure.
And then for girth, there's again, not much, but right now the kind of the safest thing is usually like fillers, just like we get fillers on our face. You can get fillers for your penis. And so those are more safe, but again, there's not a ton of data on them. And so generally, I recommend people like, you are perfect the way you are. You don't need a longer or girthier penis to satisfy a partner. There's so much more to pleasure than there is to the aesthetics of your penis. And while it may, we do talk a lot about it in society, right? We joke about having a partner with a long penis. Men talk about, oh, you have small dick syndrome, right? There's a lot of that in media. But bottom line, it doesn't really matter. At the end of the day, what you bring to the bedroom is different and can be very pleasurable without penetration.
I mean, you heard it here first. Doctor's orders. So... Yep. God, I love that. So something as simple as that, no one talks about that. Mm-hmm. Very much in the popular media and just our vernacular in a way to make people feel less than or dismiss them. Okay, so there's that topic. What are the other 2?
Yeah, so then within that is pleasure. So a lot of videos I talk about how to increase a woman's pleasure, increase a man's pleasure. What are the things that we can introduce in the bedroom to just overall increase pleasure? Mm-hmm. And then, I also, a lot of my stuff is on urinary stuff. So like, why do men dribble after they urinate, or how can they stop that? Why does the stream split a little bit? So sort of things that like every day, right? These are our normal everyday activities, and you don't even realize they're a problem until they become a problem, right? And you're like, man, I wish I could pee like I did when I was 20, or I wish I could pee normally.
Should they be
again.
able to?
Well, so your stream should generally be, so in terms of men, let's talk about men first. So men, as they age, all men have a prostate, and that can enlarge and cause problems with urination. So it is very common for men to get an enlarged prostate. So 80% of 80-year-olds have an enlarged prostate. So it's very, very common, and that can affect urinary stream and flow. So it is sort of expected that some change in your stream will occur, but it should not be affecting your quality of life, right? Because that's the major issue. And if it becomes very bad, it can cause difficulty urinating, cause pain, can cause kidney problems. Mm-hmm. So generally speaking, if you're having trouble, we recommend you talk to your primary care or see a urologist. In terms of women, things can change your stream over a lifetime, like having babies, having prolapse, which is like a hernia in the vagina, having weak pelvic floor muscles. All those things can change your urinary flow, but generally speaking, most women don't have the same sort of decline or difficulty in urination that men experience.
Got it. Okay, so that's something super relevant again. Mm-hmm. And if it's not happening to you, you have older family members where I'm sure you've heard them talk about this one way or the other.
Yeah.
Okay, and then for women, what would you say is probably one of the biggest topics women come to you about?
Yeah, so 1 in 3 women will have leakage in their, as they age, 1 in 3 women. So a lot of women come to me with either leakage or overactive bladder, meaning you gotta go, can't make it, you're going a lot during the day, or you're waking up at night to pee.
What age range?
So it starts as early, some women have it as early in the 20s, but certainly it increases as you age. And so we estimate that 16% of the US population has overactive bladder. And then leakage, I said like 1 in 3. So it's very, very common. And, you know, a lot of us think it's normal, right? You like jump on the trampoline and you leak a little and you're like, oh, that's normal, no big deal. But it's not technically normal. It doesn't mean that you have to do something about it, but there are options. And so that's really what I want to empower women with, is there are options to improve your leakage if it's bothering you, right? Like you don't have to live like this. And I think a lot of women in particular, we spend so much time taking care of our children, taking care of our partner, taking care of our aging parents. And then finally, we don't get time to take care of ourselves, or we don't ever make ourselves a priority. And so I see women 20 years down the line. They've been dealing with incontinence for 20 years. They've been in diapers. They've been, you know, whatever it is, they've been struggling and they've been pushing through. And because it's like, oh, it's just, I'm just pissing my pants,
it's
right?
not
like
pain.
It's not like I have cancer. It's not like I can't live. They just keep pushing it down the line. But there's a real cost to that, right? There's a real productivity cost. You might be going to the bathroom a lot. You might spend more time like addressing that. There's a social cost, right? You may not go to things. You may not feel intimate with your partner. There's real cost to it. Well, and economic cost, right? There's cost to pads and diapers and whatever. So there are real issues related to it that I don't think there's enough awareness about.
Okay, beautiful. So yesterday I saw an article, and I would love for you to expand on this. The article said oral sex is now the leading cause of throat cancer, and beating out cigarettes and alcohol. A study came out, again, who knows who ran the study, but is that a surprise to you?
You know, I wouldn't say that it's a surprise in sense of like, yes, we know that, you know, if you're exposed to HPV, right, through oral sex, that can be a cause for cancer. And so certainly the issue is that people are not using any sort of barrier protection when they're doing oral sex. Like people think that oral sex is not sex, right? They think, oh, I can't get pregnant through oral sex, so I can have oral sex with however many people I want and do it with anybody, but they're not using for men a condom, for women a dental dam, or anything like that. And little tip,
pun intended.
Little tip, if you don't have a dental dam, cut up a condom and you can use it as a dental dam.
How? We're going to talk about the mechanisms. Let's talk about it. How exactly is that possible?
So you're just going to cut off the end and you're going to cut it into a square, right?
Oh,
yeah. You just cut it in half, cut off the end, and you can use it as a dental dam.
But do not ingest it, please. Do not do that.
Yes.
You'll be in bigger problems than what we're talking about.
But, you know, everyone has condoms, right? It's like so common, but people don't always carry around dental dams. So if a man is performing oral sex or a woman's performing oral sex on a woman, she would have a dental dam available. And so I would say that, yes, I'm not surprised in the sense that no one, like, I don't hear of anyone using barrier protection during oral sex because they think, of course, I can't get pregnant, so I'm safe.
Wow. Okay. So, well, there's that. So that's something people should take into consideration.
Yeah.
Okay. So switching gears now from like the medical stuff, I want to talk about you just as a professional and a woman and a mom of how many children?
2 boys, 10 and 7.
Okay.
Yeah.
Mom guilt. Tell me about it.
Oh my God, it's real, right? It's real. I'm here right now. My kids are home because they're off from school and I'm feeling mom guilt. And I will just tell everyone who's going to be a mom or is a mom that this is never going to go away.
Ever.
Like you're always going to have mom guilt, but like you owning, like giving yourself time to spend with friends or time to do the things that matter to you or work, even if it's working on your job, like your kids need to see that too. They need to see you prioritizing yourself so that so I have boys, so when if they identify as heterosexual and marry women, they will then, you know that that's expected. Like that's what my wife is going to need, right? That's what she's going to have and that's normal. And I want to support her in that. But if you're constantly giving to your children all the time, then they expect that from the entire world, right? And so I think it's super important for them to see you doing things that are valuable to you, and they're seeing the results of that, whether it's you're a better mom when you're there, you're more present, you're happier, like those things matter. The time you spend with your kids matters when it's quality time. And we've talked about this off podcast, but like being present when you're with them and like sitting on the floor and playing games with them and like really like talking to them and having those meaningful conversations, like that goes a much longer way than just sitting there because you feel like you have to and missing out on something that you could have enjoyed.
Absolutely. And then you've seen it, and I know there's that wellness and health connection where you have these, you mentioned it, especially women, do not put themselves first. They know they have to go get that checkup. They know that symptom is presenting, but I have to do this with the kids, and then I have to do this with my friends, and I have to do that, and keeping up with the Joneses. And those are so interconnected that if you don't do this and understand the mom guilt feeling is going to be there, because we were taught that, and you do want to be with your kids, but at the same time, you also probably love not being with them, which is okay to say too. Working or having you time or not, whatever it is that for you, and understanding that there is that direct health connection. Like that is your time to go in and go to that doctor, go see whoever you need to see, whether it's mental health, your physical health, or your whatever. Okay. So you mentioned something about teaching your children, should they have a partner that wants to do this when they get in a relationship. How is your partnership structure like? And how important is that? Because we talked about this as well. And I appreciate that you said it. And it's something that I don't hear resonated a lot. You talked about the importance of a partnership in raising children.
Absolutely. I mean, I think, and it's interesting when you get married. I got married very young. I got married 26. And so I had no idea what my partner would be like as a father. I just knew him as a person. But I think it's so, so important to have a partner that values what you're doing and that is on the same page with you in terms of parenting, right? Because one, I tell people, like, when you're looking for a partner, you want to make sure a few things. One, they have the similar values to you. They have similar financial goals to you and similar ways to spend money, because that's really important. And that's a huge problem in marriages moving, as you age. And then I think really, like, when you become parents, just know there's always going to be controversy. There's always going to be fighting over small things. But ultimately, the bottom line is you want to raise kids a certain way and you need to be on the same page about that. But also, like, your partner needs to be a parent. They're not babysitting. I hate when you see those advertisements like, oh, was it Joe Jonas recently, right? Like, he's babysitting the girls.
I hate that.
He's a dad. He's a dad. He's a father. He's fathering his children. He's not babysitting them.
Thank you.
And so, my partner is super supportive. Like, he never says, don't do this. He's like, I'll watch the kids go. I want you to always be able to make time for friendships. He knows it's important to me. He knows I'm an extrovert and I need that. He knows it's important for me to be able to do the things I need to do. So he's very open about saying, like, yes, you do this. I got the kids. And of course, I, as a partner, will check with him before I say yes to anything, right? Because say, for example, he's just, everyone has their give and take days. Like, say he's really exhausted or he's just had too much, he needs a break, then I'm not going to go to that thing that time, right? I'm going to say, no, I'm going to be here for you. You rest. I'll take the kids, take them to the library, take them to a movie, hang out with them at home, but you rest, right? And so I think that's super important, is like knowing what your partner needs and kind of figuring that out. And it's not always 50-50. Like, people say, like, oh, it's should always be 50-50. No, there's no way for it to always be 50-50. Some days he's going to be 60. Some days I'm going to be 40. Some days I'm going to be 70. Some days he's going to be 30. And it's just knowing that that's going to happen. And like, the desire to say, well, you're not doing this right now, is like, look at the global picture, right? Like, what have you always been there for me for X, Y, Z? Like, so you're having a bad day today, like, just kind of always going back to that. Like, it's not about that moment. It's about the big picture.
Absolutely. And that's teaching, I guess, teaching children how socialization works as well, the give and take of it all. And so we hear a lot out there right now about, I don't need anyone's help. I could do it myself. I'm woman. Hear me roar. F men. That. What are your thoughts?
Look, I think, again, this is obviously a personal view. Yes. But I love being married to my partner. I love having someone to raise my children with. And I think I would feel lonely without him, and there is something about being able to come home to being held or being loved or being just them being smiling when you walk in the door. Right. And like, having that support, it allows me to do everything else. It allows me to do my social media. It allows me to be 100% at work. It allows me to be really a great mother when I'm with my kids, because I have someone there supporting me. And so, yes, sure, you can be a single mom and you can raise kids, and you don't need a man to even have kids anymore. You can go to sperm bank, you can get IVF, you can have a baby. And that's fine if that's what you want.
Right.
But I personally think that doing it with a partner is a much more rich and full way to live, if you're able to, right?
Sure.
If you can find the right person. And I think the other issue is with social media now, we're seeing like the highlight reels of everybody. And so we're like, why is my partner not like this? Why is my partner not like this?
Yes.
Why don't we look like this in pictures? Why don't we go on these amazing trips? And like the reality is, you don't know what's going on behind their closed doors. You have no idea. Like, stop keeping up with the Joneses and start thinking about your own life and how you feel day to day. Like, if we live our whole life for anybody else, like that's not a way of living, right?
Torture. Okay, so you are now based in OC here in California, Orange County area, as a new transplant. And so let's talk about that, because I get a lot of people reaching out to me and I want to make a career move. And that's just talking about a career, and they're staying in the same city. You moved across the country from back east just recently, picked up your family and your job, and you didn't know anyone here really.
Yeah.
You had no connections here, and here you are thriving. Can you walk me through what led to that decision, the move itself? Because this really tunes into what people reach out to me about. It's like, I want to make a career move. I want to get a divorce. I want to get married. I want to go against family. Like, it's such a profound, big thing. How did you do it?
Well, you know, I think we just have always been, like, me and my partner, again, we make these decisions together. We've always been really in tune with like what we want and what our goals are. And we realized for us as a family that living somewhere that was warmer allowed us to be outdoors more. So we lived for a couple of years in Dallas where we did fellowship, and we really thought that lifestyle was super important, like being able to be outdoors, be more active.
Because you're coming from
Maryland, which is moderate temperature. It's not a bad place to live, but it's certainly, there are colder months where you just don't go outside really, you know, unless you're one of those people who likes to bundle up and go outside, you know. So that was a big thing for us as a family. The other thing was like, you know, we always wanted to, we realized we were just going through the motions. We were going to, you know, I was going to work. I loved my job in Maryland. I have no complaints about it. I loved working in academics. I loved my partners, loved my residents. I didn't leave for my job. I left because we were thinking about different opportunities for us and sort of deciding like, okay, where can we be? What's a big city? We're big city people. My husband's from Queens. And so we've always wanted to live in a big city. Where can we live that would allow for that? And, you know, we settled on Orange County for a variety of reasons, but, you know, the schools were good, the weather's great. And we just said, you know what, we're going to do it. And we didn't even think really twice about it. We just were like, we want this. We're going to do it. And, you know, my parents are in Buffalo, New York. They're super far away.
Whoa. My
husband's family is passed, or at least his immediate family. And so really we were like, we don't have support out here, but we've always been very self-sufficient. Like we want to be the ones raising our kids. We want to be the ones involved. We can always find babysitters or help if we need it, but like, we're not relying on anyone else to raise our kids for us. Sure. So it was sort of like, well, we're just gonna do this. And you know, it's funny, the second I started telling people like, oh my God, congratulations, that's so amazing. And it's like, a lot of people said I could never do that.
Yes. And
it's like, yes, you could.
You actually can.
It's a matter of just taking the step. It's super scary. I'm not saying it was easy. I'm not saying it wasn't stressful.
And you had little kids.
Yeah. And it was scary to wonder if they would do okay in school. It was scary to wonder if we would like living here, if we would enjoy the challenges of living in Southern California. You know, there's challenges everywhere, right? So, but they're different. And so I think, you know, it's obviously scary, but like, I don't regret it for a second. And I think like, you know, what's the worst case scenario? If you make a change that doesn't work, there's always another path. There's always something else you can do.
It's never finality.
Yeah.
So what about like, because parents sometimes, I'm sure you hear it too, parents say, well, I'm not ready to make that change in my life because I don't want to disrupt the kids' school. I don't want to disrupt their friends group. I hear that a lot. A lot of people, well, I can't take the kids out of school because, you know, I don't want to disrupt their friends group or their socialization. You did it.
Kids are resilient. They're really resilient. And, you know your kids best. Like, I can't speak for anyone else's children, but I will tell you that I knew my kids were adaptable enough to handle it. That, yes, there would be challenges, but I knew that over time they would, the resilience is important. The challenges are important. Like, what challenges do our kids really have these days, right? Especially if you have a reasonable job and you're providing for your children. They don't have struggles. Right. So like giving them a little struggle is not a bad thing.
So good.
And, so we sort of look like, well, now they've had a little struggle. It's not a huge one.
No,
they
but it's
moved,
good.
but
They
like
learned
it's a little
from it.
struggle. They had to change, they had to modify, they had to adapt, but like it wasn't bad, you know. Like we've moved throughout our lives so many times because of my training. We make friends everywhere we move. You know, we connect with new people.
Yes.
We make friends. Some stay long-term friends, some don't. But it's never like a regret. It's never like, oh man, I wish I never lived there. I've
Sure.
never looked back and said that, you know. And if you did, you just move. Like just be willing to change your environment, whatever that is, your job, your work, your you know, your living space, your like even your neighborhood. Some people are so scared to just move out of their neighborhood, right? It's like just try something. Like worst case scenario, you move again. Like yes, it's hard. Of course, it's hard. It's not ideal if you do something big and it doesn't work out, but that's part of the struggle, and that's it. Failure is probably the best thing for you, right?
See? I always tell you, failure is the way. Failure is the way.
Yep.
So as a new transplant here in this new city, a lot of people, again, taking it back to the feedback I get, I don't know how to network. And that's just them in their city where they grew up. How do I make new friends? How do I get out of my old friend group and build new community? I'm just so embarrassed. How do you do it?
You know, I find like, so social media has been super helpful. I won't lie about that. I've made all my friends, a lot of my friends here are from social media.
Okay.
So I reached out, like some of them I knew from before, and I'm like, hey, let's meet up. And so I've made friends through them, and then they've introduced me to other people. Or, you know, you move somewhere and you find out like, oh, hey, this person from my college or from me, medical school lives in the area. So you reach out, right? And you just say, hey, do you want to meet up for a coffee or a drink or whatever your choice is, right? And it may not lead to anything, but it may lead to a really solid friendship. And so just try. And other things, you know, my husband does, he'll go to like little meetups. Like when we were in Dallas, he would go to these entrepreneurial meetups. And he's not an entrepreneur in the sense of like, he's not building a business, but he's very interested. So he'd go, he'd ask interesting questions, and people would be like, oh, you have really good questions. And that's sort of how he like, first of all, was like networking with people who were sort of interesting and novel, but also connecting in a different way. And like, because of the internet, you can find these meetups, you can find tons of things to do. And like, yeah, it's scary if you're a little bit shy to go into a room of people you don't know. But you just make a goal to talk to at least 2 people or 3 people, right? You're like, I'm going to go and just talk to them. And they may not want to talk to you, and that's okay. Like,
okay.
It's all right, right? And I think women, we have a harder time because men had to like ask out women to date. So they get used to a little bit of rejection.
Interesting.
You know? They get used to like, I got to ask her out and she may say no. And so they may ask out 10 women to get 1 date, right? Depending on, you know, a number of factors. But like women, we don't ask for a lot. We get asked. We're used to being the ones who are propositioned, who are like, you know, will you go out with me? And so then you're like, oh, how do I make friends? Like finding friends after school is so hard because now you're not in a place where other people are trying to make friends.
Or this age group. You know, we have our families. People are kind of insulated and set in their ways. And so, but they were very quickly realizing, wait a minute, I actually want more and I want to expand. I want to learn. And so they face these kind of situations where I'm embarrassed. I don't want to go. I don't know anyone. That's why you should go. Right. That's exactly why you should go. Yeah. Don't know anyone and go and be uncomfortable. It's okay.
Yeah. Growth happens in the discomfort, right?
It's the best part. Yeah. So how can people reach you? How can people follow you? And you actively take patients, correct?
Yeah, I do. Yeah. So I, on social media, you can find me on all the platforms at Rena Malik MD. So my YouTube channel, Instagram, TikTok, Facebook, everywhere.
All of it. I'll list it.
Yeah. And then I see patients in Newport Beach and on telemedicine. I'm licensed in 7 different states. So if you are in one of those 7 states, it's California, New Jersey, New York, Maryland, Virginia, Texas, and Florida.
Oh my gosh. Can you add Louisiana? Just because I have a house there, and if I ever need something, I'd love to call you.
Sure, I'll think about it. So you can see me as a patient. You can go to my website, www.renamalikmd.com/appointments. And it's super easy. I made it for people like us who like don't have to, I hate making phone calls. So literally you go on there, you click a time and a date, and you get an appointment. And what I do is I review every appointment request to make sure that I can help you before you come in to see me, because I don't want you to waste your time and come see me and I don't have the skill set, or I don't think I'm qualified to treat that one particular condition. And so then you just wait for a approval, and then that's it.
Okay. And then, so we'll end talking about telemedicine, which what do you think of the change? Because right before COVID, telemedicine was barely even a thought.
Yeah.
Now it's here.
Yeah.
What do you think?
I think it's great for a lot of things. I think it allows access for a lot of people who didn't have access, particularly in rural parts of the country, or if you want to see a specialist, right, in something, but they're not local to you, or flying to California or flying somewhere is, out of your capabilities, or at least you don't want to go there just to find out the person can't take care of you or doesn't want to take care of you or whatever the case is, right? And so I think it allows for that. I think a lot of things can be managed without a physical examination, but a lot of things need one, right?
Sure.
And I think in general, like what I will do is if I can't see you, I will maybe refer you to, like I might talk to you about your problem and then refer you to a doctor in your area. And so I also do educational visits. So like people who are not in those states can come see me and we'll talk about their issue and I'll give them general advice. Like, of course, I can't tell them a diagnosis or a treatment, but I'll say, look, this is what you should talk to with your doctor and go back to talk to your doctor about it. And, if you need help finding a urologist, I can help you with that as well. And I can call that urologist and, let them know about you. So I think it's really valuable, but I will say, like, if your doctor says you need a physical exam, you should go get one. So that means whether it's seeing that doctor or seeing someone else locally, to make sure you get a physical exam, that's really important because there are some things that we can't diagnose just by what you're telling us.
Got it. Okay. Well, I appreciate you just for being here and really, truly for you putting yourself out there, putting your education out there and making the safe space and conversation for us as humans to be healthier, to be okay with ourselves and to ask these questions that we've been told are, taboo or not okay to ask. And so I appreciate it. And I hope everyone follows all your pages, all your platforms, because it's excellent stuff. And I love it. And it's very, very informative. So thank you, my friend. I appreciate you for being here.
Thank you so much. And thank you for doing this. You are helping so many women around the world. Like, you have no idea. Yes. People who are afraid to take charge of their life or do the things they've been scared of. You are giving them the permission to do it. And that's so powerful.
Yes. Love that. Thank you, friend.
Thank you.
Bye.